So all you're going to do, just kind of like, if you guys have ever done like a suboccipital release, right? Where you just cup your hand into it. Awesome. So similar hand positioning here. All you're going to do is provide a distraction when they're symptomatic to see if that helps relieve some of their pain. There's a couple hand positioning here. I like this one. Dr. K likes this one as well. Some people do a chin grab like this and pull this way. The patient doesn't like that too much. So if you can get a good grab on their occiput here and kind of pull towards you, it seems to help. I would wait probably about 10 to 30 seconds to make sure that, see if they can sense a change in their symptoms here. Okay? This one, if you sit up and just face them. Whatever side they're having their radiculopathy on, you're going to ask them just to rotate their head to that side, and what you're going to look at is see if they can at least get 60 degrees of cervical rotation in an upright position. So if he turns and he's really wincing in pain and he gets a reproduction of symptoms and he's like only turned 30 degrees or 45 degrees, you know that's a positive just cervical rotational test for this cluster. So active range of motion at least of 60 degrees rotation to there. So vertebral basal insufficiency. Essentially what we're trying to do is see if by cutting off the vertebral artery, if it elicits some sort of neurological response. The 5 Ds, the 3 Ns, and the actual 1A is, you guys know those? You guys know those pretty well? Mm-hmm. So those are all neurological signs and symptoms that if they present with,
Quick question, what's the A?
The A is ataxia. Yep. Yep. Do we need a refresh for all of them? Or you guys good? Okay, good. So there's several sequences here that we can do. So if you scoot over, we'll do them together, okay? Actually, everyone will do them. So the first one is you're just going to have them go in extension. If they're experiencing those symptoms, have them go in extension and hold for about 10 seconds, right? And then they'll come out of that position. You kind of check their nystagmus. While they're in that position, you kind of see how they're feeling after they've had their head in extension for a while. And then we can start adding in rotation. You can hold 10 seconds right, 10 seconds left. And then the big ones that might elicit this is if they do it actively, rotation and extension, right? And if I did rotation to the right and extension, which vertebral artery might be getting closed off? Right or left? You guys can sense the same one? Right. I think the right too. Right? So we're getting some closure and then extra closure in those facet joints. So all the while that they're doing this and they're sustaining this position, you're watching their eyes, you're looking for nystagmus, you're seeing if they get dizzy, if they're starting to look faint. All those would cue you to get them out of that position. If you're still unsure, you can actually passively take them down to this position. So you want their shoulders to line up with the edge of the table. You're going to lay back, and then you're going to drop their head. Keep coming this way. You need your way that good. Side bend and rotate. And then what you're doing here is you're checking their eyes and watching their hair. This is like Spider-Man. Provide a posterior pelvic tilt is to take a blood pressure cuff, put it in the space their low back, inflate it to about 10 millimeters of mercury, have them hold the actual meter, and then say, try to make this spike up, right? So if they push into that, they'll put pressure into the cuff, and then that meter will change, right? And then you know they're doing that activity right. The same thing for deep neck flexor. You can put it under the back of their neck here and have them work on a chin tuck exercise, right? And their goal there is to try to increase the pressure and sustain that position. And they're all the while they're just reading this right above their head as they're performing chin tuck. And if they can't do it, if they can't raise that needle by 6 millimeters of mercury, or they can't hold it for 10 seconds, then that's indicative of very weak, deep cervical neck flexors. The one test that we can do is the neck flexor endurance test. So I want your patient to put a finger on his chin, and then what you're going to tell the patient to do is keep your finger there, pull your chin down through your neck as if you're trying to get to the table. And if you lose that position, it's a failed test. But I want you to hold that position, keeping your mouth closed, and raise your head 1 inch off the table. And when he lifts up, you're going to start your timer. And you can see how long they can hold this position. So we'll just watch him.
What's the finger for?
The finger is a very good manual cue for them. Some people can do it like this. But what you're looking for is the wrinkles in the neck, right? If those start to open up, or he starts to get really far off the table, he's compensating, right? So he's not doing too bad. Keep that chin tucked more. There you go. See that? So it's really easy to fall out of that. You can rest. A normal test would be 38 seconds. You should all be able to do 38 seconds. A